Welcome back to the Cycling for Change podcast. Cycling for Change exists to bring awareness to the evil that is human trafficking. I'm your host, CJ Quarterbaum. Today, I am joined by Dr. Sandeep Kapoor. Sandeep, welcome to the podcast.
Thanks, CJ. Thanks for having me.
Please tell us about yourself. Who are you? Where are you from? And what do you do now?
Yeah. So I am born and raised from New York. I grew up down the street from where we're recording this in Syosset. And I've had an interesting, I would say, personal and professional journey. One that has led us to here today. Personally, like I mentioned, I grew up in a modest house down the street in Syosset where I really learned the values of humility and being humble from my parents, both who worked really hard, first generation immigrants. Mom was a nurse at Syosset Hospital. Dad was a federal agent for the U.S. Treasury Department, and just throughout life, I always found value in finding opportunities to help others. And then professionally, I think that's really what's brought me to where I am today is manifesting some of those learnings that I still see on a daily from my parents. Um, Now I have I would say, a fairly exciting role at a very large health system here in New York, Northwell Health, where I lead addiction care for our 18 emergency departments, as well as I serve as an educator at our medical school.
Wow. How did you get involved with Cycling for Change?
I think that question leads to the same answer for everybody. Dr. Santosh Palas, a colleague of mine who definitely we share a lot of similar qualities and characteristics in terms of trying to do the right thing for others. Santosh, I think I had the privilege of joining one of the Cycling for Change events. I think it was a golf tournament a few years back. And when I learned about his professional, as well as his family oriented mission around mitigating and ending human trafficking, he had me at hello. And I think that day, actually, I asked him, how can I be of better service to you in the mission, which led to just conversating about events that he was planning, other outreach efforts that he had within our organization, um, and then resulting in me serving as one of the executive board members.
It's awesome. When you think about this issue of human trafficking and all that we've seen and just how hard it is, and then you think about your work in addiction care, how do you see the two relating?
Yeah. The commonalities, they're definitely there, right? Human suffering as a whole, I think, regardless of um, the point of focus that causes that suffering, there's a lot of commonalities that people go through. Um, and if I really reflect back of where my journey started with Cycling for Change, it actually started within Northwell Health when I heard Dr. Paulus presenting about his process in terms of screening individuals or understanding red flags that we as healthcare team members may interact with someone and identify some red flags that they may be either a victim or a survivor of human trafficking. And that's where the similarities began because about 11, 12 years ago, my team and I, we started to populate this messaging around our large health system around how important it is for us to identify and recognize if someone is suffering with alcohol or drug issues. Both very stigmatized, challenging issues, community health, public health issues that create a lot of suffering, yet are not mainstream healthcare points of focus. So right then and there, I think the similarities come right back to understanding that you have human beings that are in need of someone to acknowledge. They're in need for someone to appreciate, to accept what they're going through, and then being willing to be a partner. Not us directing people to get away from their trafficker or to stop using drugs or stop using alcohol, but really trying to partner to understand what could satiate some of their critical needs that are there right then, as well as long term.
Yeah. This is a question of social welfare, right? How do we create the well-being for all in society. If you find yourself in a place of addiction or in a place of being trafficked, we can say that your well-being is not being cared for. From your vantage point, how do you partner with people in these situations?
Yeah, that point you bring up about well-being and generalizable well-being, right? Um, it has to be an evolving process,
Mm.
right? Because if you just look at traditional medical education, for example, right, as a standard, our point of focus are on mainstream healthcare conditions that even my 14-year-old could appreciate at this point. Unfortunately, human trafficking, substance use disorders, gun violence prevention, like all these things are not part of that mainstream educational component that we've been exposed to and that now we perpetuate in our professional lives. So the only way that we're really going to be able to make a dent, to even create avenues of mitigation or support folks, is by taking a step back and self-reflecting and understanding what our shortcomings are.
Mm.
We first need to build our awareness. And the only way we're going to build our awareness is by having a flexible mindset. If we feel, and in healthcare, this is a prominent feeling, if we feel we know best at all points in time, we'll never be able to partner with that individual that's in front of us that's suffering from something that we just don't appreciate as being important. So I think, cycling back to cycling for change, cycling back to what Dr. Paulus is doing, what my team is trying to focus on with substance use, a lot of it just comes down to first and foremost awareness building, brewing motivation, allowing people, individuals, to actually reflect on the importance and the power they bring to this complicated equation. There's no on-off switch, but we have to start from somewhere, and awareness building is pretty much where everyone's got to start.
So how in your hospitals, how do you build awareness?
Ah, it's a challenge. Just like any organization, just like any industry, right? Change is challenging.
Yeah.
So the way that I believe we've seen success is by understanding the folks that we are respectfully challenging,
Mm.
right? So, yeah, we could put things on paper, beautiful workflows and flow charts, great graphics, educated. We could put all that together. But if we're not really understanding the learner, and what they're going through, the traumas that they may be bringing to the table, the apprehensions, the jadedness, the experience that they are all bringing to the table. All of us have our own traumas, jadedness experience.
Yeah.
If we don't take a moment to actually appreciate where they're coming from, we'll never be able to actually raise their awareness because they'll be closed off. So part of our approach is really level setting, that all of us are coming with some baggage to this table, but are we willing to put that aside and keep an open mindset for the benefit of evolution? Meaning, can we evolve our thinking so that we can actually meet the cries of our communities, as opposed to just the checklists of no heart disease, no diabetes, no cancer, you're good. There's so much more to health than just
Yeah.
diabetes, cancer, and heart disease.
And considering that 87% of Americans are metabolically unhealthy, we're not even doing well in checking those boxes.
No, absolutely not. Absolutely not. We're definitely, there's definitely room for opportunity,
Yeah.
and improvement. And again, with any industry,
Yeah.
right? So you look at the airline industry, right? We have this level of trust with the airlines that we buy a ticket, we take the most precious assets in our lives, our families, on these flights, knowing that there's some level of safety and security. But we know that it's not 100%, but we're giving it a chance and we have trust. Healthcare, unfortunately, doesn't hold that same value of trust when it
Mm.
comes out to the community, because for years, and even now, we have flipped a switch on our communities where they have a certain expectation. We have not been able to live up to it. So if you look at, for example, substance use disorder as a healthcare condition, or you look at human trafficking as a healthcare condition, which we all feel it is. We all feel it's a public, community, individual health condition. What has healthcare really done to step to the plate to support individuals that are in need, that may be arriving at our clinical settings in crisis? Traditionally, unfortunately, there's a lot of shame, a lot of stigma, a lot of discomfort. And then most likely the plan is how to exit that individual from the site. And I'm not speaking on behalf of any organization here. I'm not speaking I'm talking about the industry at large. our goal probably has been to discharge that individual because we don't know what to do. No one's ever taught us. And unfortunately, we don't probably think it's our issue to support them with. Um, so yeah, so talking about 87% of folks that are metabolically challenged and dealing with disease process, a lot of it goes down to, have we even had the privilege of gaining those individuals' trust to help support them? And we know very well we haven't. Universally,
Yeah.
we have not.
Yeah. This is the first time I've heard someone in a conversation about human trafficking. We always talk about it as a justice issue, which it is. This is the first time I've heard someone refer to it as a healthcare issue. If we take that view and we spin this conversation in that way, what do you think it does for this fight against human trafficking?
Yeah. So I got to be honest. I'm not the first one to say this, right? I mean, I am a amplifier of what Dr. Paulus and the team have been shedding light on. Within our organization, around the country, at the UN, internationally. Um, I'll tell you, we have to ensure that if we are trying to garner buy-in and motivation from others to be part of this, we need to empower them. And part of the empowerment for a healthcare professional is to recognize something as a healthcare issue, right? So let's say you drove a Porsche and you pulled up to my house and said, "Here's my keys. Can you change my oil?" I'm going to look at you like you have three heads. And I'm going to say, "Dude, I don't know how to change the oil. No one ever taught me how to change oil of a Porsche." Now, fast forward, someone comes in potentially dealing with human trafficking to a hospital setting. You're going to get the same response because no one's ever taught us. No one's even framed it as a healthcare issue to us before, because we may only hear of it as someone else's issue. Not my neighborhood, not my house, not my community, no one I know, no one I love. But then on top of it, it's only a social justice issue where law enforcement should be involved. But what about the impact to that person's well-being? That's health.
Yeah.
That's health, right? Food security, depression, anxiety, substance use. All these things are intertwined to a certain degree. That's health. We have power. So at least from my angle and my lens, I'm going to continue to speak of it as a healthcare issue because I know there's a glimmer of empowerment in that statement to bring thousands and hundreds of thousands of healthcare professionals to the table as active partners as opposed to witnesses.
Yeah. That's so good. Yeah, there's a holisticness to this approach where, yes, law enforcement should be involved, but when you think about the impact of being trafficked on a person's mental, physical, emotional health, that is 1000% a healthcare issue.
By far.
Does this topic even come up in med school?
No. So, again, I can't speak for every medical school in the country or in the world. I can speak as a medical educator. No, this is not part of core curriculum in medical schools. And that goes back, I would say, centuries at this point, right? Like the focus was physical health. We're now seeing a lot of headway with mental health, behavioral health. We're also seeing some headway now with spiritual health. All three, by the way, that you just mentioned, all three of those domains are impacted by human trafficking.
Yeah.
But even look, there's 54 million people in this country that are suffering with a substance use disorder. 54 million.
Wow.
30 million are suffering with diabetes. My 14-year-old can talk to you about diabetes. The average physician in this country at current state cannot talk to you about a substance use disorder. So there's already a lot of disparities that are perpetuated by the gaps in medical education. Now, I'm at the same time, in demonstrating with data some of the downside of where we're at, there's a lot of positivity. So our medical school at Hofstra, down the street from here, that is a joint school with Northwell Health, we have created opportunities for our medical students. And I frame it as such, opportunities, not just education, but opportunities for them to explore what value they individually bring to the cause, right? So we do now teach them about human trafficking. We do have a 30+ hour curriculum around substance use disorders, right? We are teaching them about social determinants of health, about gun violence prevention. These are all little teasers, right? Because these are such complex issues.
Yeah.
How do you frame it within a couple of hours? But the framing is really where the value for effort is. Because by framing it within the medical school curriculum, you're giving these young minds the opportunity to explore, to say, you know what? I want to learn more about that. Maybe I should get more involved. Or why am I not seeing this modeled when I go out in the clinical setting? And in turn, they start modeling up.
Mm.
Their curiosity brings change.
So, what are some of the outcomes you're seeing from this?
Yeah. So from the medical education point of view, outcomes are, I'd say outcomes are measured in different ways, right? So yes, we do our basic evaluation and assessments based on the session, right? Like what resonated with students, what questions did they still have, but you see it in these sessions is activity. There's
Mm.
proactivity in their voice, right? There is empathy in their voice. They're connecting with this topic because we have the benefit of bringing folks with lived experience to the table to shed light that, look, it's not just all darkness out there, but I'm an illustration of hope. Yeah, it may have been a dark unlit pathway, but now I'm standing in front of you trying to educate you on what you could do, like someone may have done for me. And we do that with the human trafficking effort. We do that with our substance use effort. We do that with our gun violence prevention effort, is we bring voices of lived experience. And that in itself is a magical outcome, because then what you're not only doing is expanding the knowledge base of these young minds, but you're also expanding their hearts to the cause. Downstream outcomes, we've had medical students that now have progressed to their career at the med school, where they're doing their clinicals in third and fourth year in our facilities, and they're reaching out directly to us. They'll reach out to us and say, hey, listen, there was a patient on the floor or a patient on the emergency department. I was concerned about their substance use. I was concerned that they're dealing with human trafficking. The team I was working with was not aware. How do you suggest I approach them? That right there is, to me, a very insightful call for change
Yeah.
and asking for backup, right? Because the first thing that we do wrong in healthcare is we don't say when we're wrong. We don't say, I don't know. For these young students to say, hey, listen, I see something going on here, but I don't think the team I'm working with is appreciating or understanding what to do. Could you get involved? And our actual main response, and I would say it's true for Dr. Paulus as well, is empowering them. First and foremost, empowering them to at least raise the conversation, and then also point them to resources. Resources could be me, it could be Dr. Paulus, it could be somebody else, it could be a team, it could be a program. But that's where the change gets driven. It gets modeled up via these students, and those outcomes are, but I used the word before, magical, but those outcomes are magical.
Yeah. I mean, the ripple effects that are going to come from this,
Yes.
it's going to be incredible. When we talk to Jenna McKay about her experience,
Mm.
she escapes human trafficking.
Mm-hmm.
And I think she said 6 years later is when she realized that that is what she had experienced,
Mm.
because she went to the doctor, had a panic attack, and someone pulled her aside and said, hey, have you experienced this, this, and this?
Yep.
Hey, I think you've been trafficked.
Yep.
She goes, I thought this was just normal. She goes, how many times did I go to the doctor and exhibit these same things, but they just didn't have the eyes to see? And with and I'm gonna say, because I like to assume people aren't malicious by intent.
Mm-hmm.
So I'm going to assume they just weren't trained to look out for these things.
I think that's unfortunately how basic it is. But things that are basic sometimes are the
Yeah.
most harmful.
Yeah.
Right? So yeah, I don't believe there's malintent. I don't believe there's malintent, but if we continue to idly stand by and allow medical education or even societal education to follow the same trajectory, then there is malintent.
So this is kind of the conversation we were literally just having before we started recording with smartphones and technology. Gen Z was I call them the guinea pigs,
Mm-hmm.
but we have more than enough data now that if we allow things to continue the way they are, that's our fault.
Yeah, I mean, we have a lot of lived experience, if you will, right? Like, I mean, I remember there was a time where my fingers were like shriveled up because all I was doing was using my phone for emails, for social media, for all these things. It would be a uh, it would be a misinformed approach if I didn't share those warnings with my own children,
Yeah.
right? That, look, these devices are helpful, but there are some red flags that we should look out for. And technology evolves too. And now the new iPhone, it tells you if you're holding it too close to you and it
Yeah.
gives you a warning. That's great, but that doesn't change the behaviors of the utilization as a whole, the
Right.
frequency of utilization. It may protect your eyesight a little bit, but there's a lot more work that has to be done. And the same, coming right back to human trafficking, if we are learning through advocacy of, let's say, Dr. Paulus and others on the team, we're learning about what human trafficking looks like, right? Because that blew my mind, actually. The first time I sat through one of Santosh and Wolanda's trainings, I sat there and I learned very quickly human trafficking does not equate to sex trafficking,
Yeah.
because that's what Law and Order will teach you on TV,
Yeah.
right? That's what, like all these cop shows that you watch on TV, that's what they'll teach you. But it's a lot more than that, to the degree of just even thinking about landscapers, right? Just the labor human trafficking that's happening around us. And we are immune, like we're just like normalized to it. But we don't understand the impact that it may have on that individual's lifestyle, their health, as well as their family life. And then it starts putting things into perspective. But it's also paralyzing because you realize really quickly how big the equation is,
Yeah.
and you get paralyzed and you don't know where to start. And that's where I think it's really important that if you're trying to empower people, you also have to give them a starting point. And the starting point could be just identify red flags and get somebody else connected, right? Because if we try as an individual solve everything for everyone, we will be unwell, and we'll also probably feel like a failure because there's not always a good outcome,
Yeah.
no matter how much effort you put in. Thinking about that individual as one of those partners in that equation, right? Not just resources and services, but even the individual, to realize and appreciate that you are a trustworthy person to speak to about this, that what you are suggesting in terms of options is something I can consider. That's the most valuable partner to have in this equation. And that takes communication strategies and
Yeah.
skills and empathy. Removing that healthcare approach of the parental, you need to do this, as opposed to where do you feel we can begin.
Yeah. What are some of the red flags you teach people to look for?
Yeah, that's a great question, and I'm not the expert here on that, but from what I've learned, um, you know, red flags for human trafficking itself, could be being fearful, being at a clinical site, being fearful of who's accompanying you to the clinical site, unexplainable history, medical history, or even like family history, because there's a closed downness, there's a palpable mistrust in what will be shared. Um, Not very clear description of housing, of finances, of
Mhm.
employment. Um, those are just like the self-reported, I would say. The lack of self-report of certain things would be a red flag. But then also the physical red flags, right? Like, the same thing that what we've learned from TV, like, in terms of like, seeing wounds or scarring, I would say malnutrition, signs of someone not taking care of themselves, but at the same time, there's not real clarity of why that's happening. Um, Leaving against medical advice, conflict again with the guest that may be there with that individual, understanding how important it is to separate folks sometimes, so you could actually build some rapport and garner uh, honesty with a trusting relationship, as opposed to fear by a witness, or I say witness, but let's say by the trafficker being there, preventing these types of conversations. Um, Unfortunately, there's a lot of red flags. It doesn't all equate to human trafficking, though, but it should at least, get the hairs on the back of our neck going, saying, "Hey, there may be something more going on here," and then finding out the right communication strategies to really elicit in a thoughtful, non-chaotic environment of what's going on with that person. And that's where trauma-informed care comes in, right? Not what can I do for you today, but what happened to you, right? Like
Yeah.
even simple reframing of a question could potentially open up dialogue that has been hidden for so many years.
Yeah. I think asking the right questions is so big. And I think a lot of the things you just named, something like not clear reporting on housing and income, if you don't know to look for that, it's very easy to just skip over it. I think another issue is probably the amount of time that doctors have with patients. this cycling and churning.
Yep.
It is hard to kind of sit and see the person in front of you
Yep.
when in the back of your mind you're like 7 minutes and they got to be out.
Yeah, look, there's no shortage of challenges,
Yeah.
and that's one of the biggest one that you just mentioned. There's no shortage in terms of time. Time is a big issue, and it's not an issue that we're going to resolve.
Yeah.
Uh, to me, it's about diversification, right? It's not building new. It's about diversifying.
Hmm.
We in healthcare have the privilege of somebody, a family sitting in front of us who's trusting us, that's
Yeah.
looking to us for some level of support. We need to figure out a way, either individually, through our team members, a social worker, a nurse, a coach, whatever it may be. We should give that individual in front of us the opportunity to share who they are. And even when I said housing, finances being a red flag, these aren't traditional questions that come up in a standard healthcare visit. We're learning how important it is to explore these things with the whole movement around social determinants of health. But this was not traditional part of medical practice because one, it could feel very invasive. And we, as a society, anything that could be invasive, we'll use it as an excuse not to explore because it makes us uncomfortable. Finances and housing play a very, very big role in people's health, not just human trafficking, but plays a very big role in health. Yet we have not been trained to understand and appreciate the value there is to even ask these questions in a non-judgmental manner. Traditionally, finances only come up when it comes down to like administrative kind of filling out the paperwork, insurance, sliding scales if you're, a non-insured patient, don't have Medicare or Medicaid. But now the new generation is bringing that into our clinical conversations because it's important. How can you potentially prescribe someone an antibiotic for something is a bacterial infection when they will not have the means to go pay for that medication at the pharmacy? Or they live in an area where the pharmacy doesn't stock that medication. Like, unless we dive a little bit deeper, we are undercutting our own process in trying to help people.
Yeah. I love this conversation, hearing about the kind of just the innovations and strides that are being made within the healthcare system. Because we've done things one way for so long, and you have a new generation that is coming in and saying, hey, there's some gaps here. And it's not to say that you're wrong or you're completely bad, but we want to improve. That's the whole point. And so, even in this human trafficking conversation, it's saying, hey, maybe we should ask some different questions. Maybe we should start to take a look at some different things. I love the conversation about mental health because we're both children of immigrants. Um, you know how immigrants tend to be sometimes from older generations where you don't talk about your feelings, you bury them and you keep it moving. I have to tell my mom all the time that mental health wasn't invented in 87 when I
Mhm.
was born. It's,
Mhm.
it's been around. You guys just had different ways of dealing with your issues, but we're seeing the ramifications of not dealing with those things
Yep.
and just the harm that it could have on us as a people. And if we are harmed as people, it harms society as a whole, and it takes us away from being the best version of ourselves.
Absolutely. Yeah, the consequences, the ramifications, the outcomes of the shame and judgment around mental health is, I would say, this highlights the marginalization of human trafficking
Yeah.
and substance use disorders, and for some diabetes and obesity,
Yeah.
right? Like, I mean, we as a society are so quick to jump on people and shame them for what they come forward with or what we can visually see. We need to start moving away from that. And it's not just in society, because frankly speaking, we all live and work in the same society. So we're going to bring that to our job sites. We're going to bring that to our communities, our churches, our, wherever it is. Like, we're not different people because you put on an ID badge.
Yeah.
Frankly speaking, you're not a different person when you're up there and doing a sermon. That's the beauty of what you do. And I was a witness to your amazing, I would call it a talk, but to me, I think it was very inspirational. I think your amazing dialogue that you shared with us during the Cycling for Change event that we had over here, you were your authentic self. And at least and we had just met that day, but I felt that way. Now, unfortunately, not everyone's authenticity is fueled by empathy,
Yeah.
right? It's fueled by jadedness. It's fueled by what we were taught around our dinner table, where mental health was not a conversation.
Yeah.
You cried, you were told like, stop crying.
Or I'm going to give you something to cry about.
Yes, right? Like, I mean, the whole thought process of generational neglect around mental health, because it just wasn't a term, it wasn't a thing. But no, no, people were depressed, people were committing suicide, people had anxiety, people had bipolar disorder and schizophrenia. We just were not aware to how to approach this as a society. Now, I think COVID allowed us to better appreciate that it's much more generalizable than we think. It's not just that uncle. It's all of us, right? Like everyone realized very quickly that, wow, there are things going on in our bodies, in our minds that are well beyond our understanding.
Yeah.
But that was a commonality that we all had.
Yeah. Oh man.
And I love the way,
Mate's book, The Body Keeps the Score.
yes,
Just perfect on this.
yes.
Perfect.
And I'm going to say, I love the way you framed to your mom about like, hey, mental health wasn't invented in 1983 when I was born. I'm going to challenge you respectfully on, even framing what we were talking about as innovation in healthcare. It's not. It's common sense. Like a lot of people will frame it as innovation, right? Because, oh yeah, you're doing great things. Yeah. No, no, no. All we're doing is going back to the basics. Like we're talking about caring for humankind. I mean, that's literally what healthcare is. This is common sense. I'm going to give you an example of this, right? So a knee surgery, right? Okay. So everyone in our society, in our world, knows someone that has a knee surgery, right? And I guarantee you, if that knee surgery happened in the last 12 years, the person that had a knee surgery probably got 14, 16 phone calls post-surgery. How you're feeling? Did you take your medications? Did you pick up your medications? You have 3 appointments with Dr. X, Y, and Z. Any signs of infection? What color is the sky outside your house, right? We care and manage a knee surgery because there's a big financial component that if that person comes back to the hospital within a certain period of time, it impacts the bottom dollar, right? It's called a bounce back. Why didn't we keep that person healthy outside? You didn't keep them healthy. They came back to you around the knee surgery. We're going to pay you less. Okay. So big care management programs out there around something like a knee surgery, around congestive heart failure, around COPD, asthma, all these different things. Okay. So now someone comes in to an emergency department in this country, intoxicated or with a non-fatal overdose. How many phone calls is that person getting post-discharge for the next 6 months?
Maybe one.
If you're lucky, probably the standard would be 1, most likely 0. Why is that? Substance use disorder is a chronic medical condition. I already shared 54 million people in this country have substance use disorders, overshadowing diabetes, heart disease, and cancer individually in prevalence. The shame, the stigma, the jadedness, the stereotyping that we've done, the dehumanization we've done with this disease process, in my opinion, is why we're not outreaching that person after they leave, saying, what else can we do for you? In my opinion, there's this thought process that is a moral failing, that person is less than. Now, again, not fueled by malintent. It's fueled by a lack of education. Now, if I told you that we had the privilege of partnering with a community-based organization down the street from in Hicksville, and we created a care navigation program where out of our 11 emergency departments in Nassau and Suffolk County, if someone we see is dealing with a substance use issue, we'll offer them what we call Project Connect, which literally is somebody that will be by their side to serve as an advocate, a champion, a navigator, someone with lived experience, by the way, who will help shepherd them through the complicated landscape of addiction care so they can find their own definition of well-being or recovery. Literally, it's the knee surgery model, right? We have helped thousands of people through this process. I will not call it innovative. Somebody else will. Someone will be like, wow, that's really innovative. You're helping people with substance use. No, it's common sense. I know it's a long-winded story, but like sometimes it's about going back to the basics and what people understand. Chronic medical condition, and you don't call them after they leave, or chronic medical condition, and you keep engaging, trying to offer support just a shoulder to lean on. Even if there's a relapse, if someone slips, whatever it may be, we're still there by their side. That's what healthcare really is about. It's about being a partner and not just a one-time
Yeah.
good luck to you.
I mean, as people, we're wired for community. We are not meant to be alone. So the idea that someone is dealing with a chronic issue and having community care helps them get through it, you're right. That is just common sense. And for us as a society to be more connected than we've ever been, we're sitting in what professionals are calling a loneliness epidemic.
Mhm.
So it's telling us something about the connectivity that we have, not producing the results that we need in our souls.
Yep.
And I think, what would you say, Project Connect was the
Yeah.
name of it?
Yep.
Is just the perfect example of this.
Yeah, thank you. I agree with you. I think the caliber of connectedness doesn't meet the needs of connectedness, right? We may think a text message here or there is connecting with someone, where someone actually just needs a phone call.
Yeah.
Someone needs a face to face. Someone needs eye contact.
Someone needs a hug.
Someone needs a hug.
A hug.
Yeah.
But-
But we're being primed now
Yeah.
that a WhatsApp message to wish someone a happy birthday is more than enough. Where back in the day, we would write a greeting card.
Mhm.
We would go to a birthday party. We would hand it to someone. We would mail a postcard. All that stuff has gone away now. And we're relying on technology. But the reality is, a lot of the human driven or human impacted healthcare conditions, technology is not enough.
Yeah.
Someone dealing with human trafficking, they're dealing with a lack of connectedness to the wealth of support, structure, hope that's out there. Someone dealing with a substance use disorder is dealing with a lack of connectedness for the same three things.
Yeah.
Hope, the resources that are out there, the compassion that may be out there.
Yeah.
So I think the innovation, in my opinion, out of all this is just the reframing that all of us need to appreciate and be willing to do. It takes time.
Yeah.
Reframing, change, all this stuff takes time, but it never happens unless there's a willingness. And drawing out that willingness of individuals, it's challenging, but it's doable.
Yeah, I agree. So as we start to bring this to a close and we think about all the work that we're doing, substance abuse, human trafficking, you can make an argument that these things will always be with us for as long as humans are on Earth. So what gives you hope in the midst of these fights to keep going every day?
Yeah. Wow. That's a deep question, man, because I think it's very much individualized.
Yeah.
On first pass, there is not a lot of hope, right? Especially for folks that are in the midst of this right now, dealing with it through a family member or personally. What gives me hope is that conversations like this are happening.
Yeah.
Organizations like Cycling for Change, human beings like Dr. Paulus and his team that are trying to drive big changes in healthcare around this. I mean, there is hope, but it won't be the solve-all. It won't be the solve-all. There has to be hope because unfortunately, there's way too many people out there that have zero insight on what hope looks like right now.
Yeah.
And if we could reach one of them, two of them, hundreds of them, well, then we're doing our job. And when I say job, we need to create hope in healthcare settings, in faith-based organizations. We need to create hope in law enforcement because every one of us has that ability to evoke emotions that allow people to visualize hope. So let me say that again, right? No matter where we work, no matter what we do as a hobby, as a passion, our interactions with individuals, each one of those are opportunities for us to evoke connectedness, trust, relief, right? We could evoke those emotions in people so that they could actually feel some hope.
Mm.
It's a kind of metacognitive kind of thing. But it's really important that everybody finds their own personal value as opposed to talking about generalized. Because look, I could give someone hope tomorrow without even realizing, just by showing up to work. Just
Yeah.
by making eye contact with someone, I could give them some hope because you don't know where they're at. Then if I have the privilege of really understanding where they're at, yeah, I could layer hope on top of hope on top of hope. But I have to be there for that person first and foremost.
There's power in presence.
There's power in presence, and there's power in each person. And for all those folks that say, "Oh, I don't know where to start or I don't know what to do," just start by raising awareness, your own. Don't even
Yeah.
take on a whole mission. Just raise your awareness. Open up your mindset to this. Because even that is presence, right? Because that knowledge base, that empathy that you are garnering around this topic, it will give hope to somebody else when the time is there.
And that's what we do. We are bringers of hope. I think there is hope in that we're not giving up. We're having these conversations. More and more organizations are popping up. We're not going to quit on this.
We're not. And not only are we bringers of hope, I think the only reason we're even in that privileged position to do so is because we have been benefactors of others giving us hope.
Yeah.
Right? I personally, and I referenced my parents earlier. I mean, if there is one term I can say that they have given me throughout life, throughout every success, failure, challenge, hardship, it's hope. Not everyone has that privilege, but everyone could hopefully identify someone that's given them some hope. And now we're paying it forward.
Yeah. I think in all of our success stories, there's always more than one person that we can look back and say, because of them. That's Malcolm Gladwell's book, Outliers. The whole point of that book is to say, none of us get to where we are on our own.
Mhm.
It is through the love and care and work of others that we are where we are today. And so my hope is we will continue to pay that forward so that others can have hope and in turn do that for others. Dr. Kapoor, thank you for your work, for your
Thank you,
fight,
CJ.
for joining us on the Cycling for Change podcast. We exist to bring awareness to the evil that is human trafficking. So thank you for joining us for another episode, and thank you for continuing to fight. See you next time.